Good evening, everybody. Welcome to the Sheila Exchange, another Friday afternoon, 5:30 p.m. Kuala Lumpur time. And today we are actually going to talk about a holistic approach to health management. Holistic health is something that's very close to my heart. I'm one of those people who prefers to go the way of alternative or complementary therapies to sort out long-term ongoing ailments that have no sort of concrete medical reason, don't require me to take antibiotics. And even then, I prefer to not go in and take painkillers and medications. But of course, being a sensible person, when I have to, I will go. And that's what I actually wanted to to discuss today. When do you go for alternative therapies? When do you go for, normal, go to the doctor and get medication? So today I have with me someone who's superbly qualified to talk about this and sort of pander to my need to know more. I have with me Dr. Anusha Nair. She's been in medical practice for the past 15 years, of which 10 have been spent in family and complementary or functional medicine. Dr. Anusha is passionate about achieving health from the inside out, and she blends the best of the East and West, right? As very unusual for a medical practitioner, I must say, as well as she incorporates modern technology with ancient practices to achieve a holistic balance in healthcare. Not only that, so she's a practitioner of something called neuroelectrovascular stimulation. We're going to find out from her what it's all about later. Don't worry about all the big words. And she has invented a non-invasive method of pain management for treating osteoarthritis of the knee. She's also somewhat of an inventor also who has come up with a skincare brand called Noosh, which you can see in the background there. Noosh Naturals for patients with skin problems. And also, very interestingly, having this glorious curly mane, which she has sort of tangled with, pardon the pun, for most of her life. She's also come up with hair care products that help the woman with very curly hair to celebrate having curly hair. Thank you for joining us today, Dr. Anusha. Thank you for being agreeing to come on the Sheila Exchange.
Thanks for having me, Sheila. It's really an honor. I always look up very highly to you, so it's really nice to be invited to talk to you this evening.
That's so sweet of you to say. So, by the way, she is also a doctor that I have consulted in the past for my aches and pains and my skin problems and so on. We'll tell you about that later. Dr. Anusha, what made you interested in this holistic approach to healing?
Okay, well, first of all, my father has been, a big part of the whole process of why I'm doing what I do. This is basically me carrying on his life's work. So my father has been a practitioner of holistic or complementary health for, oh my gosh, I think 40 plus years. And he started actually dabbling in holistic medicine, I think in the 1980s. And at that point, many doctors were calling him, the crazy doctor, the quack in, Paramount Garden. So it was very like the terminology of doing something out of the ordinary in terms of the medical community was very derogatory. But, the patients kept coming because the treatments were working. And he had a very out of the look outside the box kind of view on how to treat health in general, because you would notice that many treatments or many ailments in the medical textbooks are like etiology unknown. You don't know what's the cause. It's genetic. It's all this big stuff that basically means we don't know, so you don't know. And even if you try to find out, it's wrong. It's basically, since it's not in the textbook, since people, the general medical community does not know the answer, if you were to look outside or elsewhere trying to find your own solution, it automatically made it wrong. So that's kind of like the realm of medicine that the Western medical practice lives in. So you will notice that there is a more fluid approach to health in terms of Eastern medicine. And so there is a definite cause and reaction. The causative, there is definitely a interplay between factors which they look outside the traditional senses in terms of what is your diet, what is your emotional status, what is your habits, what is the foods that we eat, is it according to your body type. There's a lot of other factors to look into to actually give you more answers. And so he started looking to traditional practices to find answers, and he did find a lot of them. And the thing is that now if you were to go from in a general traditional medicine perspective, many concepts are quite vague. But what my father was able to do is actually take those vague concepts and incorporate them into anatomy, physiology, biochemistry, so that everything had a sort of made sense. And that was
So he gave
how,
a science to that. He put a
yes,
science and a framework, structure to that.
yes. And that, yeah, and that is basically what we practice in our clinic.
Okay, so not many doctors. Also, your father was a pioneer back then when, I agree with you, because even at that time, back in the 80s, right, when I wanted to go and see an iridologist and acupuncturist and all that, people were looking at me like, what are you going into all these new age mumbo jumbo occultic things? I'm like, seriously, Eastern medicine has been around for far longer than Western medicine, right? Long before we had pharmaceuticals being manufactured and all that sort of thing, drugs and all that, people were relying on natural herbs, natural therapies and things like that. So I think there's so much to be said for Eastern philosophy and medicine, but not many doctors trained in Western medicine, like you and your father, are very open to the so-called Eastern or alternative or complementary methods of healing. Why do you think this is so? Why do you think there is this need on the part of many medical practitioners and trained in Western medicine to clearly delineate between Western and Eastern medicine?
I think it's more to do with medical legal than anything else, because the medical faculty has become very much litigation concerned, and so if it isn't proven by some sort of scientific means, you you are open to litigation if you were to go down that path. So because of the litigation involved in medicine per se, I think many doctors would not suggest alternative methods in fear of that those outcomes.
And yet, Dr. Anusha, in the East, in China, in India, even sort of like in Malaysia, for example, if you went to a hospital like Institute Cancer Negara, they do offer acupuncture, they do offer alternative therapies and, detox therapies for those who have gone through chemotherapy and all that. So our Asian countries are beginning to recognize this. So
I think you also notice that not many Western trained doctors will be practicing those. They would just refer them to the people who practice it and not be really involved in terms of, okay, why don't you try this or that? They would just refer them straight to the acupuncturist to make their own management and whatnot. So doctors and the East and West are not working hand in hand, so to speak, because they're kind of, they still have that divide. It's just that when the traditional medicine practices have nothing else to offer, then they say, okay, you can go and try other ways, sort of thing, and let them try therapies, so to speak.
Yeah, so really, I think there needs to be more of a dialogue going on between the two to find out, because I think at the end of the day, it's about seeing what's best for the patient, right? Like,
Definitely. Also getting perspectives from the Eastern medicine counterparts as well, and taking those perspectives as a valid opinion. That's
Yeah, I agree with you, because I think some of these complementary medical practitioners have been in the business for like decades longer than, you know, some of the doctors have come out of university or medical school, and they have tried and tested, you know, and your father has managed to merge both, you know. So the philosophy of holistic healing believes that the mind, body, spirit connection, so that the imbalance in one area can actually impact the others. And I've been reading books by like yourself, medical practitioners who've seen this connection. And one of my favorites is Dr. Gabo Mate. You know, he says that the root cause of many major illnesses lie in emotional stress and trauma. And I myself, you know, I'm not a therapist, I'm not a psychologist, but I am a coach. And there are sometimes people who come to me with certain medical conditions. And then I've said, have you seen the doctor? Have you seen the specialist? Got the blood test, got everything? And they come and say, yeah, but nothing is wrong. I even went for an x-ray and all, nothing is wrong. But their pain persists and their condition persists. So then we go back and then do some emotional clearing, and voila, the problem disappears. So what are your thoughts on this, Doctor?
Oh yeah, definitely. Because we cannot separate ourselves from the mind, body, spirit connection. That is basically the Ayurvedic principle. Your mind, body, and spirit are all one being, and so and they each affect one another on a continuous basis. So definitely that is very, very true, and you will see that many people with certain sort of maybe mental baggage or certain emotional traumas, they will exhibit certain symptoms physically as well. That being said, that for how we go about, because in our practice we don't really delve into deeper emotional states of the patient, but we definitely recognize that certain um, emotional states can bring about certain neurological changes. For example, a very stressful environment can bring about adrenaline
Yeah.
increase, can have um, a more stress hormone release. And what happens with these stress hormone releases is that you can have gut issues, you can have sleeplessness issues, you can have all these kind of somatic symptoms from mental issues, so or basically psychological or stresses from the outside, and not being and also there is a definite spiritual component to that as well. So we find that people who are more spiritually open, they are willing to let go, because you cannot control anything. Life is like that. Life moves according to how life's supposed to move. As much as we try to control things, we cannot. And learning to accept and believing in a higher power and learning to let go of those particular things you cannot control is also part and parcel of the whole process, the mind body spirit connection. And when you make that connection with the spiritual as well, you'll find that that's when inner peace, and this is what people have been talking about from eons.
No, I totally kind of agree with you. I think, you know, our bodies are expected to function in a sort of optimum level. That's how it is. But then things happen, sometimes emotional trauma. And I'm also a believer that emotional trauma can be carried in your genetic material as well, because I've been reading stuff on epigenetics, which tell you that things that, you know, happen amongst your forefathers and ancestors can actually be carried. It's very interesting. We had a comment from Nora Abu Hassan. She says, our forefathers sure used holistic healing in those days. Absolutely. You know, those days where we didn't have generations ago, we didn't have so many qualified medical practitioners. We all resorted to other means. Now, Dr. Anusha, it says in your bio that you practice functional medicine. It's very interested. I think our audience is very interested to know what is functional medicine exactly.
Yeah. So I know there's a lot of people say complementary medicine, but people oftentimes associate complementary medicine to like more traditional medicine like Ayurveda or TCM. Those kind of things are more like complementary medicine. But functional medicine is basically like doctors who are trained in medical in Western medicine, but also incorporate things where we look deeply into your diet, your lifestyle, your habits. We ask you details of how, what's your day like, and your sleep pattern, all those kind of things to kind of establish where exactly the problem lies, and try to give you, of course, real solutions as well as behavioral and diet modifications to try and get you back on track.
So basically putting together all the pieces of the puzzle that people don't sort of normally see as being part of their whole health management. You do that, you investigate, put them together and create the whole picture. I like that word, functional medicine. I think I'm going to start using that. I'm looking for a doctor practices functional medicine. That makes a lot of sense, rather than just someone who's treating a symptom and dumping medicine on you without actually going through and looking at the root cause. Now, another thing is that you carry out in your clinic a therapy for internal balancing and healing called neuroelectrovascular stimulation. I think I sent my mother to you for some of that treatment, which did a world of good actually. But can you explain what this process of neuroelectrovascular stimulation is all about? How does it work?
So basically, this is my father wrote his PhD on this in 2012. It's basically what it is we outline certain factors in the physiology which can bring about an imbalance. So the Chinese medicine is always going to talk about yin and yang, hot and cold. And the Ayurvedic principle is talking about vadam, pittam, kapam in terms of this cosmic balance that you have internally.
Too much water, too much fire and all that, yeah.
Fire, yes, exactly. So, but in terms of scientifically, we bring this principle down to an internal pH balance. So we are always, working on an equilibrium, and the body is always, even as we speak, as we do things in life, it's always one thing has to give for another thing to happen. We are always in this equilibrium, so to speak, throughout our living life. Yes. So what this treatment process does is actually it comes back down to the basis of where these imbalances lie, and more often than not, it is basically circulatory issues and neurological issues which bring about chemical changes in the body. So the points that we have used is basically something like acupuncture, but we don't use needles. We use little buttons and we stick them all over. And using electrical pulse, we target nerves and blood vessels which are related to the rest of the system, to open up the circulatory system to regain a better physiological balance by well, there's a more technical terminology. It's like a 400-page thesis that we wrote.
Okay, I think I know you're going to spare us that. So, it says electro, so it's using like electrodes to, so what you do, is it a bit like when you go for an ECG and then you have all these little pads sort of put to measure?
Yeah, well, ECG measures your electrical pulses from the heart. This is actually delivering
it. So it's the reverse cycle, right? Okay, so
vital energy.
Okay, that's great. So how would you know that someone has that sort of imbalance? You do like a blood test or?
Well, some things come up in blood tests. So if they were to have like a hormonal imbalance or something that we can measure in a lab test, then yes, that's what we would do. But many things don't come up in blood tests, especially when it's neurological. So there are ways that we can examine and just determine, which areas need more help than others. So for all our patients, of course, we do thoroughly investigate them in a Western medicine sort of way to at least monitor progress, because we don't want to just say, oh yes, you're better, trust me, you're better. You
Yeah.
know.
Yeah, you need to have the data, if you're going
Yes.
to be, approaching this scientifically. I'm actually very happy to hear that, because in as much as I'm very open-minded, but I don't subscribe to mumbo jumbo stuff. I always like to know what is there's some scientific basis. And if there are case studies, okay, I have a question here which I will shortly address to you. If there are case studies that you can show, or evidence that you can show of the success, that's actually enough, you don't really need to go into the whole all the 400-page manual about how it's happening. I have a question from Angaya Kani. She asks, does anger really decrease pH and increase acidity in the body?
Oh, yes, yes, yes. So there's a whole bunch of things that happen when you are angry. From the what hormones are released. So you see, our body doesn't really recognize. We are quite like analog. I don't know. We are quite we're how do you call it? It's either off or on. So
Mm,
stress, anger, they both release the same hormones. So that means you're talking about epinephrine, adrenaline, cortisol. These are the hormones which are released when you're angry.
yeah.
And angry on a long-term basis. This is basically keeping grudges. That guy,
That, yeah, negative, angry all the time. Yeah.
so that actually causes your body to just release these hormones on a more continued basis. So what happens when you have all these very stress all these stress hormones released on a continuous basis is your body is just going to recognize that you are in a state of stress. So if you're in a state of stress, the body is always geared towards survival mode. So meaning that you are either in danger or you're running from something. So the response is that your heart rate goes up, your acidity in the stomach goes up, your bowels will not move as well, your sleep will get disturbed, because these are all states in which a stress situation is supposed to keep you on high alert. And this is the state that you will be in when you are always angry all the time. So learning to let go, learning to relax, learning to forgive.
Mm.
I mean, as much as as much as we think it does not affect us, keeping
Oh, it
grudges.
does.
It does. So in a very physical, visceral, chemical sense, it does affect you in every way.
No, I totally agree with that. I absolutely 100% agree, because I've seen so many cases, like people come to me and there's so much of aggression, and then they're having all this ill health. So, I mean, you work a lot on the body, doctor. I have helped people with the emotional part of it. And when there is a release of that pent up anger from like yongs ago, right? Childhood right up till now, I tell you, there's just such a difference in life and health and so on. Now, could you give us some success stories of neuro electrovascular stimulation, for example? What kind of ailments like does it work best, very well on?
Uh, I I think because this is a very general, how this works is we do this general therapy first. For whatever illness, we have patients with, very mild issues like allergic rhinitis, gastritis. It works amazing on these conditions. Skin disorders, also fantastic for that. Um, we do a lot of neurological disorders as well. We do see plenty of patients with like Bell's palsies, with nerve palsies. We see post-stroke patients. We have success stories across the board, and it's hard to actually pick out one. So every day it's nice to see people coming in and saying they're better and they're better and they're better. So I mean, I just take to heart that what I do makes a difference, because where they were suffering for something for a long, long time, and then they keep coming to us because they know that it makes a difference. But I think um, Yeah. I mean, I always appreciate and love our patients really like a family member, because how we treat our patients are basically how we treat our own family. And many of our patients have been with us from the 1970s and
Mm.
1980s. And
Wow.
yeah, I mean, it's a really beautiful place to work, because we really journey through life with our patients in their ups and their downs. And it's very heartwarming to see that they always come to us to find solutions, and we try our best to help them, and most of the time we are able to.
Mm.
Yeah.
I think I need to come and see you next week. Okay, so Dr. Anusha, you're the mother of 3 children, actually 4, because Nush is another one of your children at the back there, right? Right, that is something that you gave birth to your skincare brand. What inspired you to go into that? I mean, you're already doing so many things.
Oh my gosh. Well, yeah, I know, right? Okay, so this all started because I had a brain fart, so to speak, like, oh my gosh. So there was this moment where I was like, oh, one of these old aunties that you used to treat. And what I like about being here is that my father was always like a innovator and a creator. He wanted to find a way for everything and anything. He never used to say, no, I can't do that, that's impossible. He always used to like find a way. So I really admire that in him, that he never ever gave up on his
Mm.
patients. He never, like, he would always say, no, no, we'll do this, and so one of these old aunties, she had very bad knee problems. And, she was like, your treatment is very good, but I have to come here all the time. And I was like, yeah, yes, because it worked so well for her in every other way. But for her arthritis, which was very severe and her bones had already like kind of deformed, she wanted something that she could take home with her, that she could do. And so I actually taught her where to put the points and how to treat herself. And then she came back, she's like, yeah, it works, but it's so difficult, I don't know where to put. And so then I was like, oh, okay, so we have to solve that problem. Okay, so then it went on from there, just trying to solve the problem one by one. And I kind of got a bit carried away with it. And then got this knee gadget all set up. And then I wanted to, at that point, I wanted to also validate my father's work. So I was actually looking in many other directions to see if any university would actually want to um, you know, uh,
Patented. Do a
well,
study on it.
do a study. And I actually approached um, one of the universities for a head device which I made, like for a stroke patient as well. And they were like, no, this stuff has not been tested on humans before, you better to go and test it on a rat first. So I was like, oh shit, okay. So then I was like, okay, no, wait, this
And there
means,
are very healthy rats running and around, would have been running around there if you had actually tried it on the rat.
yeah. So then I was like, okay, wait, the knee TENS has been around for ages. So
Yeah.
I can definitely get the university on board to research this. So so I went about, failure after failure, trying to get some design that I could patent that would meet all the kind of requirements that I wanted in the knee strap. And so I managed to patent it. And
Wow.
of course, patenting is a very long and expensive process, and I needed a way to kind of fund it. And so Nush was that way, basically, because I was already making little remedies for my patients, on and off. And my father used to do that also all the time. He used to
Skin
have a little,
remedies.
yeah, he had a cold remedy, he had some hair oil, and he had this and that, but he really never had time to make it look nice. So he wasn't bothered about that. So for me, I was very much interested in skin patients as well, because my son had severe eczema when he was young. And we really tried everything under the sun, and finally our treatment is the one that actually helped him the most
Hmm.
to overcome it. And of course, this little skin remedy that I made as well. So I mean, I just wanted to offer that to my patients. So I just, like, very very chinchai, making it, offhand in one little corner. And the
Hmm.
patients really liked it, and they really came asking for more. So I just took it from there, and I realized that, okay, if at least I can use the funds, if I were to do this properly, finally it was my husband that just sat me down and said, look, you're put your hands in too many pies. Can you just can you just concentrate on building Nush so you can pay for the knee strap? I was like, oh yeah, that is a good idea.
Yeah, sensible man, your husband, very supportive too, I'm sure. Yeah, I've tried your skin, your Seabuck, yeah,
But
ointment, right? Yeah, yeah, balm. It is really good stuff. Help me with my eczema. I tell you, Anusha, you really want to get that money fast. Go and create some sort of balm or oil or something that you can apply on your body and get thin fast. I tell you, you'll be a millionaire overnight. See? So where are your products marketed, your niche products?
right now, we have a few places which carry it in store. So we have um, one is in Ecogenesis. This is a Sabah store. This is in Kota Kinabalu. They carry quite a bit of our stuff. The Hive in Bangsa has some deodorants and some balms. Most of the stuff is here. I mean, I keep it all here above my
Natural
clinic.
clinic. All right.
And
Okay.
yeah, and online in our online
Okay.
store, that's where you'll see everything.
All right. Great. That's good to know. Anyone who's interested, your online store is called
nushnaturals.com.
nushnaturals.com. Okay. Now going back to holistic healing, Dr. Anusha, the past year has been a really stressful one for many of us. Have you seen this being translated into more health issues that have been surfacing?
Okay. Yes, definitely. You would see more people with stress related symptoms. Um, a lot more some panic disorders and things like that have been cropping up. But I've also noticed that people have, especially during maybe about maybe 5, 6 months ago, when things 5, 6 months ago, people were trying to avoid hospitals, and hospitals were delaying appointments. And if you went into the hospital, you could not have a relative come accompany you. So all those things were actually preventing people from seeking health care in the government hospitals, and they
Right.
were delaying their very serious issues, um, so much so it would snowball into this catastrophe. So we had seen many patients with diabetic foots that were just keeping their wounds, not afraid to go to the hospitals. I had one lady who went into the hospital. She was not no relative was there to look after her. She developed huge bed sores. I mean, I don't know. These are things which,
Yeah.
uh, yeah, I
Shouldn't
mean,
be happening.
shouldn't be happening. But as part and parcel of the whole COVID crisis, the healthcare cannot cope.
Yeah.
People didn't know where to turn, and these were the situations that we were seeing, real life situations, catastrophes, COVID related deaths, which were not part of the COVID-19 statistics, because they were deaths related to the pandemic, which were not COVID related.
Right, right. So again, should a person suffering from health issues rely on just one type of therapy? If the right wingers, only the doctor and the specialist in the hospital can help me. I'm not going to try all these alternative remedies. And then you have the other side, I call them the left wingers, with its, that no, I don't want to take antibiotics and steroids and anything. I just want to go the natural way. So should a person suffering just rely on one type, or how do you really make that decision? Like for me, I have been hospitalized twice in my life, very serious ailments. I said, put the steroid, put the antibiotic, put everything, get me out of here fast. And then after that, for the maintenance, you go back and take all the juices or healthy food to get rid of all that stuff. But then how do you know when is the time to sort of go and see the doctor to get all those medication, and when you should, just go for complementary therapies? Or what you said again earlier, you called it something, right? Functional medicine. Yeah. Yeah.
Okay, well, for anything acute, you definitely I think you definitely need to see Western
Doctor.
medicine. Yeah, so acute meaning if you're having a high fever, that is one thing that you don't play around with. If you're having difficulty breathing, if you're having serious vomiting and diarrhea and those kind of issues, if you're having any sort of issue which makes you kind of very uncomfortable, you 100% have to go see a medical practitioner. Of course, if you also have chronic diseases like diabetes, uncontrolled hypertension, you can't just say, oh, I'm not going to take medication for this because I'm going to do traditional therapies and without monitoring your sugars. If
Mm,
you are just newly diagnosed and you're like, okay, I think this is a wake up call. I'm going to try diet and lifestyle changes before I start Western medication. I think that's still okay if you're monitored by maybe your family physician who can check your blood work to see if everything is okay. Is this a safe way for you to go for,
mm,
safe way to try?
mm,
So um there shouldn't be a one or the other unless
mm.
it's emergency. Then you have to rely on
Go
Western
to,
medicine.
yeah, right. So, yeah, I've heard of people, right, who have got like diabetes and they're on medication, sort of their glucophage or whatever. And then after that, they went on this whole detox program and then went and saw a naturopath and started taking natural herbs. And then sugar levels went down and they were able to maintain it with the natural medications and so on. So is that okay though? Because I always heard people say that, oh, once you go on Western medication for diabetes, hypertension, all that, it's for life, you cannot stop, because you'll die and all that. So what are your thoughts on this?
Whatever method you choose, you have to do it responsibly, meaning that you have to check your sugars. You have to see if this method, whatever method that you choose, is doing something good for you.
Mm,
So if you try, I mean, because the thing about holistic medicine is that there is no one type of holistic medicine. It's so varied. So what works for somebody might not work for somebody else, or you go to a different practitioner, they might do something different. So it's very not it's not streamlined.
mm,
So you cannot again classify, oh, because this person, it worked for this person, might
mm.
work for me. So you got to really see if this is the best method for you, and also make sure that if you're down that path, that you are actually gaining some headway and not just making yourself more sick.
Mm. Okay, and so the final thing, right? So while we're on that sort of positioning about healthcare, we've talked a lot about holistic healthcare. You've talked about some of the therapies you utilize and you believe in, which is also a very scientific approach to whatever you're doing. Now, I am a big believer that everybody must make their own decisions about their health, right? Yet I often hear of people who are suffering from critical illnesses being forced by their family members to try this therapy and that therapy, being dragged here and dragged there and dragged everywhere. And, sometimes people who are being forced, like even though they're in the final stages of, say, cancer, being forced to go and do the chemotherapy and the radiotherapy, which actually could do more harm rather than just allowing them to make their choices on treatment so that they have some quality of life in the time that's left to them. So what do you feel about this? As a medical practitioner, if someone comes to you and you know that this is the situation, what kind of advice would you give the family members or the patient of this kind of illnesses?
Of course, doing your due diligence is very important. That means understanding the type of cancer. So some cancers can be stage 4, but they do really well on certain types of chemotherapy. Some cancers don't do so well on chemotherapy.
Mm,
So being educated on the method of treatment is, because again, for cancers, it's very individual. How cancers react to different people and different types of cancers, different regimes of chemotherapy, also very different from different. And so it has to be, again, by a case to case basis. So many times people will say, oh, I'm stage 4, I don't want to do anything, I just want to die, and they give up. And so the family has to say, hey, come on, let's try something. And who knows, if you did try, then you could gain something. But then again, there are those who you could, you know, the cancer's prognosis even with chemotherapy is bad. You get the report from the oncologist is not going to do much good, but the family is still pressurizing them to do something because the family themselves are more the treatment is more for the family rather than for the patient.
Exactly. Yeah.
So
Yeah.
in those situations, definitely, like, you really need to do your research, really really thoroughly. Ask as many doctors as you can, get as many opinions as you can. Don't settle for just what one person would to say. Arm yourself with information, because only with the right information you'll be able to make the right decision. So, yeah, that's definitely what I say, because there is no right or wrong answer. It
Yeah.
just is a very individual thing that everybody with cancer has to go through. It's a very individual process. It's a very individual journey for each person. So, and the family itself journeys with that person through their illness. So, coming to a decision together is very important. Having those hard discussions and taking into account what the patient has to say is very, very, very vital, because ultimately they are the ones going through this.
No, I agree with you, because I've heard many people, like patients, who've suffered from a stroke or cancer, heart disease. Suddenly, the whole family is mollycoddling them, won't let them go out here, eat this, do that, and like that stress, I think, is enough to make them want to go. You know what I mean? I think the family should actually respect the rights of a patient suffering from any kind of ailment. Of course, you can give your advice, but pressurizing them is just going to put more stress. I've got another question from a statement from Kanish. It says, how do you balance between the natural or organic and Western medicine? I mean, if you want the best of both, then how? Can you have the best of both? We have heard sometimes that complementary medicine, traditional herbs and all that might actually have contraindications when put together with the Western medicine.
Yeah, I mean, I definitely believe that you can have the best of both worlds if you know enough about Western medicine, and if you know enough about tradition. If you take the time to do your research on on traditional methods as well. So, it's really a process where you have to also get a feel of these things, because just like how you practice Western medicine, and patients, as much as medicine is a science, is also an art. The same way goes for traditional practices as well. So learning how certain herbs work for different people, and how it works at different dosages, it's all part and parcel. So I think us doctors or medical practitioners have to be really open-minded these days, and really arm ourselves with the knowledge not only of just Western medicine, but also of traditional complementary medicine. If patients come to us saying, oh, I'm on this herb, I'm on that herb, that we don't just disregard it. We also take it to account, we learn more about it, and see if it is something that they can incorporate, and if they've incorporated it, is it helping them or not. And we be kind of proactive in managing both the east and the west side of things.
Hmm. I'm really glad to hear you say that open-mindedness is so important. And I'm happy to note that today there are more doctors, who are trained in Western medicine, who are being more open to alternatives. About 10, 15 years ago, we went and asked a doctor, a gynecologist, can I take bioidenticals instead of these hormones? I'm like, no, 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 all that, there's no proof that it works. But today there are a lot more gynecologists who are very happy to give you the bioidenticals. Yeah.
Prefer to give that, actually, because they
Yeah.
find that there's less side effects with the bioidenticals.
Correct. And I also think that, uh, you know, at the end of the day, your patient is in a sense your customer. You also, instead of just pushing down solutions and treatments onto your patients, I think it's always good to include the patient in a discussion and what works for them. And then again, there are doctors like you, Dr. Anusha, who are willing to sit down and, listen and answer all the questions very patiently. But then again, there are other doctors who look at you like, I know better because I've been to medical school for like 10 years or something. So, I really, really subscribe to your theory, your idea that doctors need to be more open-minded. In the same vein, patients also should maybe not be so open-minded. Don't go to Google and do your research and find out, oh, and look at all the symptoms and then turn around and say, I've got this, or maybe I should try that. If you really are looking at balancing complementary medicine and also Western medicine, if you're looking at the both of that, then what you would want to do is you would want to go and see a doctor like Dr. Anusha. I'm not advocating, but I'm saying go and see a doctor who is open-minded enough to give you ample knowledge and show you the best of both worlds so that you can make an informed decision. Don't be too left-wing, don't be too right-wing, be as middle of the road to find the best solution for your health. And once again, we are both advocates of holistic health. Dr. Anusha Nair is the doctor. I'm the person who helps people with their emotions, and we both agree there's a strong connection between your body, your mind, and your spirit. Don't hold that anger in, the unforgiveness, the irritation is really going to be impacting your body in the long run. Thank you for being with us, for joining us this evening. I hope you've had a very educational session with Dr. Anusha Nair. Thank you very much for joining us. You've been listening to me, Sheila Singham, on the Sheila Exchange. Thank you.
Thank you for having me, Sheila. Thanks everyone
My
for
pleasure, our pleasure.